everyone. Welcome to this virtual and in-person workshop entitled Sharing and Exchanging Ideas and Global Health Experiences on Community-Engaged Approaches to Oral Health. I'm Isabel Garcia, the Dean of the University of Florida College of Dentistry, professor in the Department of Community Dentistry and Behavioral Science, and a member of the Academies Board in Global Health. I want to welcome our participants and offer a special thanks to our outstanding planning committee, to Academy staff, Patricia Cuff and Hannah Goodtree, and to our sponsor, CareQuest. This workshop is designed to get us all thinking differently about oral health. For too long, oral health has not been considered an integral part of overall health. This plays out in dental education, where our students are often siloed from other health professional learners, and in our delivery and financing of dental care, which is structurally different and apart from medical care. Separating the mouth from the rest of the body has not served people well, a point that's called out in the recent WHO and the FDI World Dental Federation definitions of oral health that look at the whole person. This holistic view of oral health recognizes that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. This definition incorporates psychosocial dimensions such as self-confidence, the ability to socialize, to study, and to work without pain, for example. Our presentations today will provide a foundation for discussing this concept of community-engaged oral health and how we can apply it within, between, and across the health professions. We will be mindful that oral health is critical throughout the entire life course, and that addressing the oral health inequalities has to address underlying complex social determinants of health. With those just brief opening remarks, I would like to hand the program over to my co-chair, Dr. Mayumi Wilgrout, who will introduce herself and describe what we have planned for today. Mayumi, over to you.
Thank you. Good morning, everybody, or afternoon, depending on where you are. My name is Mayumi Wilgrout. I am a professor in the Department of Child, Family, and Population Health Nursing at the University of Washington, and interim director of the Center for Health Sciences Interprofessional Education, Research, and Practice. We have a very exciting agenda for you today, as Dr. Garcia had laid out. The first half will focus on the roles of different health professions in oral health and how the different professions do and could work together to ensure the entire person is cared for in mind, mouth, body, and spirit. The second half of the agenda is to get you, the participants, thinking more broadly about how care providers take care of the whole person in underserved populations, and how health professional educators prepare the current and future workforce so that they are prepared to work together with community members and advocates. To do this, we have selected to focus on babies without teeth, although there was a lot of discussion about other groups we could have focused on, including frail elderly and adolescents, both of whom are at vulnerable stages in their lives and require the support of others in multi-generational families and communities. I also want to thank my co-chair and the planning committee, and a special thanks to our sponsor, CareQuest. So to start us off, we have asked Kaz Rafia, the Chief Health Equity Officer at CareQuest, to share some thoughts with us. Dr. Rafia is a doctor of dental surgery and holds an MBA and MPH. At CareQuest, Dr. Rafia focuses on the integration of oral health with overall health care. Prior to joining CareQuest, he was the state dental director for Oregon Health Authority, where he set the equity-centered state oral health strategic plan, focusing on population health measures, health workforce development, optimization of the value-based care coordination model, and telehealth. Dr. Rafia also served as a dental volunteer for 8 years at Medical Teams International. So as you can see, his background and expertise has direct relevance to today's workshop. So please join me in giving a very warm welcome to Dr. Kaz Rafia.
Thank you, Dr. Wildegroth. Thank you, Dr. Garcia. I appreciate the opportunity. It is an absolute privilege to be here with you all. Special West Coast wave to Dr. Wildegroth. Back home in Washington, Oregon are distinctly different, but it's practically home for me. And as many of you may be already familiar, CareQuest Institute is a national nonprofit focused on building a future where every person can reach their full potential through optimal health. And this all starts with acknowledging the centrality of oral health to overall health. And as Dr. Garcia just pointed out, WHO's definition broadens oral health significance beyond the traditional boundaries to encompass broader dimensions of health. However, we know that partly as a function of historically siloed approaches to education and practice models, interconnectivity of oral health to overall health has long been overlooked and undervalued. And as a result, we have critical system-wide inequities and gaps in delivery and outcomes of care. As an example, our own extensive research here at CareQuest Institute has revealed that Black adults are 68% more likely to have unmet dental needs than white adults, or that those who identify as American Indian Alaskan Native were 3 times as likely to utilize the ED for dental emergencies versus the non-AIAN populations. And if we're serious about eliminating the disparities in outcomes that exist here in the US and globally, we must cast wider nets. We must engage providers across the spectrum and elevate interprofessional integration and training. There's really a ton of data to support that aim. What we found out in our support for medical dental integration is that, for example, 63% of adults reported that their primary care physician never or rarely asks about their oral health. And while only 1/3 of oral health providers report diabetes screening for their patients, more than half would be more willing to screen if they had better tools to identify those at risks for diabetes. In our efforts to advance medical dental integration, CareQuest Institute has long championed supporting innovative partners in academia and in the community, such as the Illinois Primary Healthcare Association in their work to advance new models of integrated prenatal oral health care in the dental safety net setting. We've also proudly supported oral health nursing education program at NYU College of Nursing to deepen oral health understanding and integration within nursing standards of care and to expand the curricula to be inclusive of serving oral health demands of patients with special healthcare needs. We've supported National Interprofessional Initiative on Oral Health to strengthen the integration of oral health within the community healthcare workforce and to advance recommendations from HRSA's Advisory Committee on training in primary care medicine and dentistry. At CareQuest Institute, we know that meaningful system transformation towards one that is more accessible, integrated, and ultimately more equitable demands collaboration and openness to learning from paradigms and successes that may not be homegrown here in the US, especially when it comes to movement towards training modalities that prioritize and invest in integrated education. We look for opportunity to collaborate and innovate in the space and strive to close the gap in health inequities. This is an incredible gathering of minds to identify opportunities and advance that very cause. And we here at CareQuest are proud to join you. Thank you again for the opportunity. It is an absolute privilege.
Thank you very much, Dr. Rafi.